My name's James Berry. I'm head of policy research and development at Core and Bath. And
And I'm Ellie Johnson, and I'm the health consultant at Core and Bath, and I work with James.
and today, Ellie, what are we going to be talking about?
We're going to talk about health assessments. Those are health assessments for children in care. And the reason that I wanted to talk about this today is that it can be really, really positive if social workers understand what health assessments are all about. And social workers and foster carers can be a real help in encouraging children and young people to have a positive view of their health assessment. So that's why I wanted to talk about that today.
Brilliant. And so, what I'm going to do today is ask you quite a few questions about health assessments and some of the things around that. So, we'll start with a quick one: is why do we do health assessments?
I think the bottom line is that we all, and I think that's quite a big word, we all want children to be healthy now and into the future, really. And it's just one of the things that we can do. But there are some regulations and guidance that mean that local authorities have to, by regulations, arrange health assessments for children in care. That's right through from children from birth to 18. And there's some statutory guidance that applies to health organisations that asks health organisations to cooperate with local authorities when they're arranging health assessments. So that's I guess our starting point. I think this thing that people perhaps don't realise about health assessments is that they have use for lots of different people. They're really positive and useful for children and young people, but also can be really useful for foster carers and social workers and health professionals as well that are working with children and young people.
I suppose what we didn't go into in the beginning and the introduction is when introducing ourselves is like, is actually yours and my sort of previous experience of health assessments. So what is in your sort of like professional life, what has been your experience of health assessments?
Before coming to work at Core and Bath about 6 years ago, my role was as a nurse specialist for children in care. And I had that role for many years, probably getting on for 15 years. And I had the fantastic experience of probably completing around a couple of thousand health assessments with children and young people. And that was right from children, babies and children under 5, right to young people as they were leaving care. So I had so many different experiences with all those children, young people.
That is a significant, number of young people and children that you've worked with in that sort of specific sort of, piece of work. And I suppose from my experience, I'm a social worker by background, and so I've sent health assessment forms to medical professionals and then had the information come back and then use that and engage with other professionals around that sort of process. But what I'd say is I haven't ever actually been to a health assessment or been in a health assessment. So who does do health assessments, just out of interest? So what sort of qualifications do you need to be doing a health assessment?
So it does depend where you are in the UK a little bit. There is some variability across the UK. Mainly, when children come into care, they need to be offered a health assessment really within about the first 3 to 4 weeks of coming into care. And the first health assessment they have is normally with a medical practitioner, a doctor. Most of those doctors are paediatricians. Sometimes it might be a GP, but services are set up differently around the UK. And actually in Wales, For example, they more frequently might have a nurse doing that initial health assessment. And then when children have their review health assessments, and those are due for children every 6 months or every year, depending on how old children are. And that will more normally be a nurse who will do that health assessment. So the key thing is that the person doing the health assessment does need to be a health practitioner of some kind. It does vary.
One of the things is that, do they take place in sort of like, where do they take place? They take place in practices. What's the sort of usual environment where a health assessment might take place?
Again, that can vary around the country depending on how services are set up. So ideally it would be wherever children and young people and perhaps their carers choose to have the health assessment. But we know the reality is sometimes that's not always possible. So it can be a sort of health clinic, and that can be in hospital, or it could be a health facility in the community. But it also could be in the foster carer's home, or wherever the child is living. So my experience was, more often I would go and see children with their foster carers or in their residential homes, and go and visit them and have an hour of their time wherever they were. Just very occasionally, maybe in school, but that's not so common.
That's interesting, because like my perception is of young people going to a clinic somewhere and being seen by someone. So it's really interesting to hear them being visited at home, and that being sort of what happens. And I suppose, just what do young people think about their health assessment from your perspective? I mean, you've obviously done there's your experience of 1,000 young people and children. They're all going to have different experiences. But how do young people find their health assessments?
Young people, I think, sometimes are quite anxious about health assessments before they come. They may sometimes not have an awful lot of information about what health assessments are, who's going to be there, what's going to happen at the health assessment. And that's really where foster carers and social workers can really help. Because if those people can explain to children and young people and reassure them about their health assessment, they can reduce that worry for the child. I think I actually remember some young people who perhaps had a couple of health assessments that were really keen to come back and have another chat with somebody that they'd already met. So some children and young people were quite keen to come along, and there was a real variety. There's been some work done with young people asking them about health assessment. So there's a PhD researcher who a couple of years ago did a study with young people, and she asked them a lot of questions about how they'd felt about their health assessments. They did say that they felt they hadn't had enough information about what health assessments were. A lot of young people reported that actually, and this is a bit worrying, they reported that they didn't really feel that they'd given their consent to what was happening. So they'd sort of arrived at an appointment and didn't really know what it was about. What was really positive in that study actually was that a lot of young people reported that that the health professionals that they met were really interested and welcoming, and actually sort of helped them with some of things that they wanted to talk about, some of their worries and concerns. So that was really positive.
And I think that's really interesting, because when I reflect back on practice, and I sometimes remember that period, ahead of that initial health assessment, that would often be after quite a difficult and intensive period running up to, say, the proceedings, where a decision may be made for a child to become looked after. and then there's a load of work to do sort of immediately after, from the child going to where they're going to live, to eating new people they're living with, and then all of the things that go along with that. And then part of that is arranging this initial health assessment. And I just, looking back, I sort of wonder about my own practice in terms of talking to young people about what was going to happen, and this part of, the process which would involve them. And so what would you say to so what would be the key message you'd say to sort of social workers in that situation?
Yeah, I think it's really important for social workers to really get to know the local system for health assessment. So there will be a system in terms of somebody in the social care team will do a referral, a notification that a child has come into care and is going to need a health assessment. That's often an administrative task, and sometimes social workers aren't quite aware really of who's doing what. So the first thing is that social work knowledge of the local system, and then I think if social workers can get to know maybe a couple of people from the local health team that are doing these health assessments, to maybe, if they've never been to a health assessment before, they can go along and find out, maybe go along with one of their children to a health assessment and find out what a health assessment is all about, what the clinic is like that's used locally. And then they'll probably find out that actually a lot of health teams try really hard to be as flexible as they can be with appointments in the first for the initial health assessment. So a lot of health teams will contact foster carers and have a conversation over the phone and say, we really appreciate this couple of weeks is particularly busy with a lot of meetings probably going on, maybe new schools and GPs to sort out and things like that. And so there'll often be, an individual conversation about, how can we make sure that the appointment time works for everybody. It is tricky because health professionals, are a bit squeezed on time. And so that can be quite difficult. But I think, just for the social worker to really find out about what happens locally, so that they can then explain that to foster carers that might not know as well what health assessments are all about.
Are there any sort of health assessments that you can recall yourself that are sort of either particularly memorable, or just actually, like, in completing a health assessment, some of the things that you found really sort of useful and powerful that sort of enable that to feel like a good health assessment for you, and or particularly for the young person or the child?
It is really important to think about what is a good health assessment. One of the things that foster carers and social workers and children, young people really need is for all their health information to be collated into one place. Because if their parent isn't there, parents basically have all the information about their child's health history in their memory, in their experience. And if that parent isn't going to be there alongside a child, then we need to do that in a different way. And so actually, one starting point for a good health assessment is when you have been able to gather all that information together. That can be from social worker, from parents, from records, and that you feel like you've got a real picture of that child's health up to now. So that's the basic starting point for a really good health assessment, and that's very reliant on social workers passing on information. And it's sometimes it is appropriate for parents to attend the health assessment, the first health assessment, or all health assessments with their children. Sometimes it's not appropriate, but actually, and that's where we often in health rely on the social worker thinking about that, thinking, is this appropriate for the parent to attend the health assessment appointment with the child, because then the health practitioner can directly ask all those questions to the parent, and that can be a really good starting point. I think in terms of sort of memorable, I'm talking about the starting point for a really good health assessment. And then there's the whole thing about, you know, we really want the children to feel like their health assessment is all about them, and for them to feel comfortable, and for them to be able to raise any concerns and worries they've got about their health. Obviously, that's really quite tricky. Like you said, James, this particularly the first health assessment, this is, you know, a really difficult time in a child's life. So to sort of make that a comfortable experience can be really tricky, and that's really very dependent often on the foster carer or residential social worker helping the child feel comfortable. I was more often doing review health assessments, so that would be 6 months or a year, perhaps after a child has come into care. So that's a different situation, actually. The carers know the children much better, and it is a different context. I think the health assessments that stick out for me sometimes are about the unusual places I was with young people. So sometimes young people aren't that keen on coming to a clinic, and they're also not that keen on you on sitting down with you when you arrive at the foster carer's home. And so it can be difficult to encourage young people to engage in a conversation. So I used to take my dog, my spaniel, sometimes, obviously by prior arrangement with some residential homes, because young people would really like to sit down with me and the dog and have a conversation. So that's possibly some of my more memorable health assessments.
Thinking about it purely from a real engagement point of view, you're trying to help a child, a young person, sort of feel comfortable and confident to actually talk with you and engage with that assessment. Was what you were thinking about?
Yeah, I never found it that easy to sit down with a form and write on it. I never used to do that. Because that was the way that I particularly worked. I'd have a conversation, and I'd know what things I was wanting to talk about with the young person, but I wouldn't sort of sit down and do a question and answer thing. But that's just the way that I used to work. So sometimes I would be trying to engage with a young person in whatever they wanted to do, sometimes just to sort of break down that awkwardness of I've got to sit here and talk to a health professional. I do remember I happened to be on a trip once with a group of young people who were sort of 16 and 17, and I knew there was I was on an outdoor pursuits trip because I was really lucky. I used to be able to do those sorts of things as well. And I knew there were a couple of young people in the group that had decided they didn't want to come to their health assessment a couple of months before. But I ended up canoeing with this one young man, and I was in the back of a double canoe with him, and he was in the front, and we ended up chatting about all sorts of things. And actually, at the end of the day on the river, I said, "Oh, you know what? Actually, we've talked about a lot of things that I would have talked about, if you'd come to see me for your health assessment." And I sort of asked him, "Can I write up your health plan?" Because that's what we like to produce out of a health assessment, is an actual plan of action for children, young people and carers and social workers, so that if there's anything that needs following up, any referrals that we need to make sure that young people get the services that they need. That's what we'll do in a health assessment. That's the outcome of a health assessment, is a health plan for that child and young person, and for all that information to be collated for social workers and foster carers and GPs to refer to as well. And so at the end of that day, I just asked him and said, look, actually, we've talked about all those things. Can I write you a health plan from what we've talked about today? And he was happy with that. And so that's what we did.
And I mean, that sounds so, that's sort of thinking outside the box to sort of actually, you've got that engagement in that moment, and actually that could work in terms of being a health assessment. And I suppose you've sort of said that what is the outcome and the information that comes out. So you've got the health plan. What is there anything else that comes out from the health assessment in terms of the information discussed in the report?
The health professional really needs to look at the child's previous health history, think what's happened in the past, what things might affect that child's health. And they do need to do a bit of analysis of that, and then summarize that and explain those things that in a way flag things that social workers and carers may need to be aware of because of the child's past health history. That can be to do with information that we have about the child's family health. So there might be things that in the future we need to be thinking about for that child. So the health professional will sort of go through that process of sort of summarising and analysing that information. Very often we find that children and young people, particularly as they come into care, that they've missed out on health services, and that we might need to be making sure that they are referred into those services again, and that we perhaps try and advocate for children to receive those services.
I've had that. I remember I was working with a child, and I sort of found out after the health assessment that they were asthmatic, and that I hadn't been fully in. And actually, I was quite, as their social worker, I thought I should have been aware of that detail, but the risks were sort of in other areas, but I hadn't been looking at that. And so then for the foster carers, it's really important that they have their asthma inhaler and understood how to use it, and how to support the young person in using that. And so it's things like that came out to me, but that's one I certainly remember.
And lots of people have said to me in the past, look, children, young people can go to their GP and all their normal health services. Why do we have these extra health assessments for children in care? But actually, GP appointments normally 10 minutes long, isn't it? If that. There's an awful lot that we need to think about for children that are perhaps no longer, with their parents. So there is quite a lot to think about, and it often does take maybe an appointment of up to an hour long to go through all the things that we want to. So we definitely will be doing some sort of health tips for children and young people as well. So for example, we know a lot of children perhaps have problems sleeping, and so we'll, as a health professional, we'll be in the position to give some health hygiene tips for children and young people. That's just an example, and we might follow that up with some extra information that we'll add to the child's health plan, so that they can go away and go and look at those tips that we've given them again. And but the other thing is that this is a real opportunity for social workers or carers that have got a particular concerns about a particular aspect of a child's health. So it might be that it's something that perhaps they're not thinking the child needs to go to their GP or to another health service about, but it's something that they want to ask a health professional some sort of expert advice on. So it's a really good opportunity, the health assessment, to do that. And actually it can be difficult if you're with a child sometimes as a carer or social worker to ask those questions in front of the child. So most health professionals are really happy for a carer or social worker to call them before the health assessment, or maybe after the health assessment, and say, actually, I'd like to just discuss this in a little bit more detail, and it wasn't appropriate. It's not going to be appropriate to discuss that when the child's there as well. So it's very much should be used as an opportunity for carers and social workers as well to have that sort of direct conversation with a health professional who's got that child's health records in front of them.
Yeah, having that sort of that's communication and just feeling ready to make a connection with another professional or someone that you're working with, just to add that bit extra if there is something in the back of your mind that you think is and just what helps children and young people benefit from the appointment? I mean, we've talked a bit about the sort of benefits of sort of like actually having the health appointment and the purpose and the reason. Is there anything that sort of you see as a real sort of benefit from this?
Sometimes children and young people can be really worried about going to all sorts of different appointments and seeing all sorts of different people, particularly when they're in care. Sometimes the health assessment appointment can be a way of re-engaging young people and saying, actually, it's okay. Health professionals are okay. It's not an appointment where we're doing anything very invasive with a child or young person. So we're not normally giving injections or taking blood, or sometimes, particularly younger children, then they might need a little bit of a physical examination, but it's not that invasive an appointment, and it can help children feel comfortable with visiting health professionals generally. So that's one sort of positive thing about health assessments, that they then might find it easier to engage with other appointments. I think it can also give children and young people a sense that we sort of really care about their individual health and well-being, and that we are, there is something just for them. We're spending a dedicated hour or two thinking about them individually. So it can make it, hopefully, they can feel like it's an appointment for them.
I mean, I just sort of reflecting, like I would always, whenever I received, having filled out that initial sort of health information, which had then gone to health practitioners and then had returned, I'd always find that there would be quite a lot of really rich and really important information that would come back to me as a child social worker, and quite often things I didn't realise about them, which just added to sort of a bigger picture. Again, sort of probably leading into a looked after child review meeting as well, and it'd be some of the information from there would be hugely important as well. Just sort of any sort of like final sort of like thoughts or top tips or anything that you want to sort of say about health assessments in general?
Well, I think social workers that support foster carers can really pass on some tips to foster carers as well, new foster carers. A lot of foster carers obviously are used to going to these appointments, but just some really simple things like, encouraging foster carers to take some things along with them to help the child feel comfortable, some snacks and a drink and some toys if they're younger children to play with. And it is just really helpful if foster carers sort of give a very positive view of the health assessment. So even if it is really hard for them in their very busy week to fit in this appointment, maybe travel to an appointment, you know, we know that is really difficult. If they can sort of just sound very enthusiastic, that, you know, this is great, you know, we're just going to go along and have a chat with the doctor, and they can do that explaining with the child. So sometimes we need the social workers to encourage foster carers to do that, and they often do.
And I can sort of imagine that as well, and just in terms of just the knowing the busyness of foster carers and just how many sort of different schedules and routines and school runs and picking up for family time, just all of that is just, you know, there's so much to manage that it's just particularly around that, often in that sort of initial period as well, when a child's become looked after, that there's a lot going on, that it can be. So I can see how that's sort of really important advice, and yeah, could be challenging. So yeah, that's good advice. Well, that's about it. So thanks so much, Ellie. I've learned already quite a lot just from this conversation. So I just want to say thanks so much for this conversation. And yeah, we'll listen to this online when it goes up.